Hello, Sierra Nevadans. Dr. Evans here. Quick update. I wanted to talk briefly about some reports that we're hearing about with the Johnson & Johnson, otherwise known as the J&J vaccine. This is the one-shot vaccine which has been available and was given emergency use authorization. So right now the FDA is, what they're saying is they're hitting pause on using the J&J vaccine in the United States currently because a few patients have developed some fairly severe, serious blood clots actually. I want to give you an idea of how rare this is, though. Over 6 million, close to 7 million doses now of J&J vaccine have been administered in the United States, and just a few people have developed these blood clots. So it's still a really rare thing to happen, but when it does happen, it's quite serious. So they're trying to be cautious, and they're trying to make sure that they understand what's going on here. So the CDC is going to meet on Wednesday to look at this in some more detail, but until then, and possibly after that point in time, the J&J vaccine is going to be put on pause. We still have available to us the Moderna and the Pfizer vaccines. And by the way, the Moderna and Pfizer vaccines, we're not seeing any of these sort of side effects with those two vaccines. They work a little bit differently than the Johnson & Johnson. They're these so-called mRNA vaccines, whereas the Johnson & Johnson is called a viral vector vaccine, a little bit different. So the overwhelming evidence is that the Moderna and the Pfizer vaccines are very, very safe and effective. If you have gotten a J&J vaccine, I wouldn't panic at this point in time, but I would make sure that if you do develop symptoms, which would be very unlikely of a blood clot, things like abdominal pain, leg pain, swelling in your legs, shortness of breath, chest pain, headache, those types of things, then please get checked out right away. If it's serious, by all means, come into the emergency department. We'll take a look at you here. But I'm not concerned about it because this is such a low frequency event. But I think it's prudent for the CDC and the FDA to take these actions. So that's it on vaccines for the day. We're continuing to provide vaccines to the community in partnership with the county and many other providers here in Western Nevada County. So stay safe out there, and I'll give you another update in about a week's time. Thank you.